Hello. So this week I thought we will take a break from the meditation and do something medical. So I thought we will do obstructive sleep apnea. In past of these YouTube videos, I have done several for obesity, and actually I started talking about obesity simply because there are too many people who are obese, and there are too many people who also have sleep apnea, and the association is definitely there. So I'm going to start with some brief introduction and talk about some of the stuff, and then hopefully this will be more informative video. A lot of people already know about the sleep apnea. So sleep apnea, A stands for absence. That means somebody who does not breathe during sleep. But in actuality, it is a combination of stoppage of the breathing as well as breathing less as far as depth of the breath is concerned. So this is not uncommon. I will go back to it in 1 second, but if you consider apnea hypopnea index of more than 5 being abnormal, then approximately 15 to 30% of male and about 10 to 15% of females have sleep apnea in US. So let me go back to this apnea hypopnea index. Index always means per hour or something like that. So if somebody is sleeping and stops breathing, let's say for example in an entire night, and I'm not talking about the total amount of time in bed, but I'm talking about total amount of events that occurred during recorded sleep, which means the brainwave recording comes in picture to have this definition. So let's presume something, okay? So let's say there are 40 events where somebody stopped breathing or was breathing less, and we have recorded 8 hours of sleep. So 40 divided by 8 would come to 5. This is the borderline magic number. So if you consider a normal person, they may have apnea hypopnea index of 40. Let's split that a little bit. So apnea means total absence of breathing. That means somebody does not breathe for at least 10 seconds. There is another name called hypopnea. Hypo means low. As you know, hypertension is high blood pressure. Hyperglycemia is high blood sugar. So hypotension is low blood pressure. So hypopnea is less breathing. So if the depth of the breath compared to the baseline breath is decreased by 30% and is associated with drop in the oxygen saturation by about 4%, that is called hypopnea. So let's take the same example. Let's say we had a recording of 8 hours of sleep and somebody had 60 episodes of no breathing, which means the breathing stopped completely, and 20 episodes where their breath was decreased by 30%, and that was associated with drop in oxygen by 4%. So there are total 60 plus 20, which becomes 80, and divided by say 8 hours of sleep, it will become 10. Say somebody did not sleep well and actually had the same episodes, but that occurred in over a period of recorded sleep based on brain waves or EEG is only 4 hours. Then that 80 divided by 4 would be 20. So this particular thing is called apnea hypopnea index. So as I mentioned above, that the apnea hypopnea index 5 is the lower number, and if you take that into account in general population, the incidence of sleep apnea defined would be about 15 to 30% in males and about 10 to 15% in females. But if we consider additional information or additional criteria, certainly the incidence would drop. For example, if I say the apnea hypopnea index has to be more than 5 and not just 5, And also, it must be associated with symptoms related to the sleep apnea. Then the incidence drop by about 5%. So in males, it might be about 10%. In females, it may be only about 5%. So as you can see, when I'm talking about it, the incidence is higher in men than in women. But after the menopause, the incidence becomes about the same as in men and female. So as a definition of any disease, there is a mild, there is a moderate, and there is a severe variety. So when there is an apnea-hypopnea index, or also called AHI, is 10 to 20 per hour, it's called mild. 20 to 30 would be moderate. 30 plus, and some people call it 35 plus, would be severe. There are varying definitions, and somebody may say 15 to 25 is mild, 25 to 35 is moderate, and greater than 35 is severe. But you get the picture. More number of times somebody stops breathing and oxygen drops, it's considered severe. Now, I don't need to tell anybody what would happen if your oxygen saturation is dropping during the sleep. Every organ in the body is not going to get enough oxygen. That includes brain, heart, kidneys, liver, muscles, period. So every organ doesn't get it, and of course lack of oxygen can lead to major problems. So lack of oxygen leads to a stressful situation for the body, and that causes secretion of certain chemicals. It causes increased high blood pressure, increased blood sugar, increased incidence of strokes, heart attack, irregular heartbeats called atrial fibrillation. Even some people feel that it is also associated with dementia and also depression. So many of these patients who have sleep apnea, which is severe and which is untreated, is associated with these conditions. And when you treat the sleep apnea, and we will talk about that in the future videos, then the blood pressure control is improved, the diabetic control is improved, the congestive heart failure is improved, the function of the heart is improved, there is a better control of irregular heartbeats called atrial fibrillation. So catecholamines, adrenaline type of adrenaline type of chemicals are secreted whenever somebody is struggling to breathe or has not breathed enough and has lack of oxygen. And this leads to all these issues, at least that is one of the theories. There are many other things that can happen with obstructive sleep apnea. So I'm just going to, who is predisposed to it? So as I was just mentioning to you, the obesity, if the BMI is higher, there is a higher chance of sleep apnea. So in a particular study, BMI greater than 30 was associated with more than 60% incidence of sleep apnea. And if it is 25 to 30, which is considered obese, considered overweight, the incidence was less. But again, normal people had smaller incidence also. So just because somebody weighs normally does not make them immune from having sleep apnea. So the neck size, another indicator of being obese, also increases the incidence of sleep apnea in males. 17 inches plus of neck size increases the incidence of sleep apnea. In females, it is 15 inches. So there are other associations like how the throat is, and there is a classification of throat, whether there is a crowding of tonsillar areas and the uvula, and whether you can see the opening when somebody opens the mouth. Based on that, there is a classification of it called Malan-Patty. 1, 2, 3, 4 are the different. So when the crowding is too much, the opening is not seen much at all, there is definitely an increased incidence of sleep apnea. Last but not least, and probably most common, is the snoring. So men, snoring, BMI, neck size, and oropharyngeal airway anatomy are the contributing factors. We'll talk about this a little bit more next time. Thank you for watching. If you like it, please subscribe. Thank you. Have a nice day.